Oh, I don't feel so good. Somebody better get me to the doctor. Folks, today we're going to talk about healthcare. Now, a lot of us are older, and so healthcare is a really, really big deal. But even if you're younger, healthcare is something you should be thinking about. When I was a much younger man, I broke my arm really severely. I had 4 surgeries. I bet it cost 100 grand. I'm sure by the time it took over a year and 4 surgeries, I bet I had $100,000. Well, it doesn't matter how old you are, and in fact, the more adventurous you are as a young person, the more likely you are to be out and causing yourselves harm. So, all of us, young and old, healthcare is really important. But if you're going to live the cheap RV living life, and that's the name of the channel, and that's what I'm proposing, is that you live cheaply. You live cheaply because you want to live the most freedom, and freedom requires being separated from the dollar bill and from a job and from all that money going out. That's how you can live so cheaply out here. But that means you're on a very tight budget. How are you going to pay for health care? And that's the question I'm getting all the time. Now, the traditional answer would, in the last 3, 4, 5 years, would have been Obamacare. If you're a lower income, you could probably get help, quite a bit of help, through Obamacare. But today, that's under attack. It may not be around so long. But your first answer is, how do I get health care if I can't really afford to pay for it? And also, you're not 65. If you're 65, Medicare kicks in. That should cover you. But if you're younger than 65, you can't afford $700, $800, $900 a month for insurance, Obamacare is the first place you should look. Go to healthcare.gov and go through their process of applying. And once you've applied, then you should be able to, they'll tell you how much you'll qualify for, how much assistance, and you'll decide then if it's worth it to you. I think around 50,000, it changes, and I'm not 100% sure of that. I think about 50,000 a year and you don't qualify. Below about 10 or 12,000 and you don't qualify either. So Obamacare is my first suggestion, as long as it lasts. And if you're a very low income, when they created Obamacare, they created expanded Medicaid. And that serviced the people who were 12,000 or less. The assumption the federal government made was that all the states would be glad to help their citizens, would take the federal money, distribute it, and everyone would be covered by health care. As you're probably aware, many states philosophically opposed the idea of the federal government being involved in health care, so they did not accept expanded Medicaid. If you need health care and you're very low income, make sure you choose a state where they have expanded Medicaid, and a simple Google search, states with expanded Medicaid, will tell you all the ones that currently do and do not. And so you can, if you're very low income, get expanded Medicaid. Now, another option you may never have heard about is Christian health sharing. It's not commonly known. Most people aren't familiar with it. It's not health insurance. Health insurance is a for-profit company who sells you insurance, and then they give you coverage for that insurance. That's not what Christian health sharing is. It's not a health insurance company. To be honest with you, I don't completely understand it. I'm not a member, I'm not a Christian, and so I have not joined one of them. I don't know if you have to be a member. You're going to have to do all that research for yourself. But if you are a Christian, then certainly it's something you should consider, or even if you're not. I believe it's more along the lines, and I could be wrong, do your own research. I think it's more along the line of the pooling of all the money, and the pooling of the money will get you cheaper service, and they will help with some of the costs, defray some of your costs, and as they pool it in, it comes out of the pool up to a certain degree. But again, I don't completely understand it. I've done some research and it's still not clear to me. Do a Google search on Christian health sharing. A bunch of the companies will come up, and then I suggest that you go to them, find them on the website, go to the company and give them a call and say, tell me exactly what it is and what you do and how much it's going to cost me. Give them your details, and then you can make an informed decision. But it is an option, and it will definitely reduce your cost of health care. So it's something you should look into. Now, finally, I saved this for the last. I think this is the best solution for all of our healthcare problems. I believe that this would have been far better choice than Obamacare, although I'm not philosophically opposed to Obamacare personally. I'm more liberal. But I think uh, health savings accounts, that's a current system put in place by the federal government, is the perfect blend of private and public that it could have worked and we could all have agreed on it. Health savings accounts, and they're still in place. They're not under attack as far as I know, and I believe they are a stunningly good idea. And that's why they've never gone anywhere, because stunningly good ideas just sometimes don't go anywhere in this country. They're too good. The basic idea is it's an IRA for health. It works almost exactly like an IRA. Every year you can put in a certain amount, you can create an account. Now you have to go to a financial institution. Your local bank won't open that account for you, but there will be a financial institution near you that will. And you don't have to get it through your employer. I can open a health savings account as an individual. I just go to one of these, either online or in person, go to a financial institution, say, I want to open a health savings account, and they'll tell me exactly what to do it. Just like an IRA, and it works exactly like an IRA. There's a $3,500 limit every year that an individual can put in. So I open an HSA, health savings account, I put in $3,500. That's my money. It goes into my account. That account has my name on it. The federal government cannot touch it. It's not theirs. It's my personal account. And I'm given checks or a debit card. So I go to the doctor, I write him a check out of my health savings account, my HSA, or I use my debit card, and he is paid out of that $3,500. So I go and I spend $300 on a regular checkup and blood tests. Doctor says, boy, you're in great health. So $300, now I have $3,200 in my health savings account. That's probably all I'm going to spend in a year. If you're young, that's almost certainly all you're going to spend. So the next year, now you have $3,200, you could put another $3,500 in there. And you do the same thing again. You go to the doctor, you got a blood test, whatever it is he wants to do, test he wants to run, another $300. So now you have $6,400 in there after 2 years. That's a lot of money. It's your money. It's in there. No one can have it but you. You have a debit card and checks. Here's the key thing. You have to open a health savings account, you also have to get a high deductible catastrophic care insurance. And the deductible just happens for most of those things to be between $6,000 and $7,000. You open an account, and after 2 years, you have the money to cover the deductible. That's the amazing thing. You do it for just a couple years, and then you have your catastrophic health insurance. And what it almost always works is the first $6,000 or $7,000, they won't pay a penny. After that, they pay 100%. And if you've been paying into your health savings account, then you have the deductible covered in a couple of years. Or maybe you can only put in half of that. After 4 years, 5 years, you have all your deductible covered. You have health insurance for the rest of your life for the cost, not paying a penny with a health savings account. But that's not all you can do with a health savings account. You can keep putting it in. So you put in $3,500 for a year, for 10 years, you've got $35,000 in there. And for as long as you keep putting it in there, it remains tax-free money. And in fact, if you only take it out to spend it on medical, you never pay taxes on that money. It's free money to you forever, as long as you only use it for medical. And now here's the little sweet part. You blow your engine. You put in $10,000 so far, and you blow the engine on your van. You can take the money out to buy a new engine on your van. You just have to pay the taxes and a small penalty. The money can be used for other things. It's like a savings account, but you pay back the taxes and you pay a small penalty. And I don't know what it is exactly, but it's not much. It's not prohibitive. So I believe that HSAs are the very best thing that could happen if the government passed a rule, every American has to have an HSA, but it's private. It's still your money to control. You can take it out of a mutual fund, you can put it all in a bank, you can put it in another mutual fund. It's your money. I just think it's a beautiful blend of private and government, and the incentives of not paying taxes on it are so great. It's a good one. Okay, so that's about all I have to offer you for health insurance. The next question I get a lot is, well, Bob, I have to go to the doctor, especially older folks. I have to go to the doctor every 3 months. I have to go 4 times a year. Or another question is, well, I bought health insurance, either paid for it myself or got it through Obamacare, but it only covers my state. How am I going to live on wheels and be a nomad and have it covered by my state? Well, actually, it's not that hard, and this is what I suggest you do. I suggest that you choose your state uh, based on location. If I lived on the East Coast, I'd make North Carolina my home base. I'd be a resident of North Carolina, and I would get my doctor in Asheville, North Carolina, because in the spring and the fall, it's pretty pleasant weather. And then I would probably spend my winters in Florida, which is the warmest place in the country. South Florida is the warmest place in the country all winter. And then I would move north up into higher. Asheville is pretty pleasant all summer. It doesn't get that, it gets humid, but it doesn't get terribly hot. And so then I would have a doctor that I pass through every 3 months through the year. Now I'm on the West Coast and I've chosen Pahrump, Nevada, because in the spring and the fall, it's pleasant. It's not terribly hot, not terribly cold. It can be real windy, but it's pleasant. And so twice a year, I make sure I pass through Pahrump when I'm going north or when I'm heading south with the seasons. And so my doctor is located where I'm close to him. When I'm in the desert in the winter, all winter, I'm only a half day's drive away from Pahrump. If I need to visit a doctor, I'm only a day's drive away. The summer, I could be anywhere, but I will usually be in Colorado, Wyoming, Montana, Oregon. And here in Oregon, where I'm at now, right now, I'm 2 days away from Nevada. I can be back and seeing a doctor in not even 2 days. I could be back to Pahrump in 2 days, but I could be back to Winnemucca from where I'm standing right now in 1 day. Not a fairly long drive, but not a terrible drive. So I could have a doctor in Winnemucca, Nevada, have it covered by my health insurance, and it's only a day's drive away. That's the idea. You put your home base regionally, geographically in the center of your travels so that you can get to the doctor every 2 or 3 months. That's my recommendation. The next question I get is, Bob, how am I going to get my prescriptions? I have to have prescriptions, and so how am I going to get them if I live on the road and I'm in different places all the time? Well, you know, today everything is tied together by computers, and it's actually pretty easy. All the Walmart pharmacies are tied together by computer, and wherever you go in the country, you can get your prescriptions dropped to that Walmart. I am hearing, and that's not just true of Walmart, that's true of Walgreens and CVS and Rite Aid and all the big drug chains. All are tied together by computer, and you could transfer them to any one of them. Or you could even transfer them out of them and go like to Kroger. Kroger has a pharmacy. Any Kroger or Safeway or Albertsons or Winn-Dixie if you're on the East Coast, wherever you are, there's going to be a grocery store with a pharmacy, and they'll fill your prescriptions. And they have the computers. They'll change it, and you can get it anywhere. Now, what I do something completely different. Because I'm on the West Coast and I go to the desert every winter. I go to Algodones every winter and I buy a year's supply of drugs. I have in my van right now, I probably still have, because I go back every winter, I'll be back down there in November. I have at least 6 months of drugs in my van right now. And I won't go into Algodones, that's another video. But it's easy to do. You just walk across the border. It's extremely safe. No prescription required. You have to have a passport. You have to physically have a passport. But you walk across, you give them a list of the drugs you need. They'll hand you the drugs and you walk out. You cross the border. You'll say, what have you got here? You'll say, I have some prescription meds. I only have 3 months. Don't tell him anything unless he asks. But if he asks, you only have 3 months supply. You can only get 3 months at a time. So you have to make multiple trips in and out to get your year. No big deal. They won't say anything. You go in 1 day. You make 2 trips in the first day. You make 2 trips in the second day. You've got your year's supply. Easy. And they're cheap. Cheap, cheap, cheap. In fact, they might be cheaper than your copay on your insurance. I would expect them to be. It's amazing. Now, some people worry they're fake. They're just sugar pills. They're just all liars and cheaters down there. I've been going to Algodones for my glasses, for dental work, and for all my prescription drugs for the last 11 years. I have high blood pressure and AFib. afibrillation, which means my heart beats irregularly. The electrical center of the atrium doesn't beat the way it's supposed to, so it's irregular. And so I'm on some drugs for that as well. My blood pressure, every time I see a doctor, it's perfect. Whatever the drugs are, even if they're sugar pills, they're doing a miracle job because my high blood pressure is perfect. My heartbeat is well controlled. The drugs are working perfectly for me. That's the only thing I can tell you. Are they sugar pills? They work perfectly for me, and they have for the last 11 years, and I'm going to keep going. And based on that, I think it's safe that if you go, you'll be okay too. One of the problems is that most healthcare plans cover just a state. You can buy nationwide plans, but they're expensive. One of the options you have is to stay in one state year-round. Let me give you an example. I've done this. I stayed in Arizona for an entire year, never left the state. And there's a lot of desert camping, and you can move every 14 days and camp in the desert in Arizona. And then you can move up into the high country. Arizona, across the north, has something called the Mogollon Rim, and it's a high uplift. So, for example, Flagstaff is on the Mogollon Rim, and it's at 7,000 feet, up 7,500 feet. Well, at 7,500 feet, you're pretty cool in the summer. It's not miserably hot. It gets warm, but it's not miserably hot. But across the whole rim, from Flagstaff over to New Mexico, you can easily camp up at 7,000, 8,000, 9,000 feet. So you can move every 14 days and never be hot, and then go into the winter, go down into the desert and never be too cold. You can still be cold. The winter desert can be pretty cold, but never miserably cold, never dangerously cold. And so you could spend the whole year in Arizona, but you could get your doctor in Phoenix or in Flagstaff or maybe even Prescott. Prescott's at 5,000 feet. It's pretty comfortable year-round. It hits 100 and it gets snow, but it's never awful. It never stays at 100 and stays with a lot of snow. It's a good climate, good moderate climate. And so that's something else you can do to keep your doctor year-round and still keep moving as a nomad. So folks, I hope you got something out of this, that you got some ideas of how you can take care of your health problems along the road, get your drugs, see a doctor throughout the year. If so, I hope you'll subscribe to the channel. I hope you'll hit that thumbs up button. Come back to my next video, and we'll talk to you later.